Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Chest pain in women: what causes it and when is it an emergency? Chest pain may indicate a heart attack in women and men but have other possible causes, including heart inflammation, a lung infection or blood clot, heartburn, rib fracture, or a painful condition like fibromyalgia. /r/n/r/n Pinpointing the cause of chest pain and whether it stems from a heart attack or other life-threatening conditions like a blood clot is paramount to preventing complications such as heart failure or even death. /r/n/r/n This article will review what a heart attack may feel like in women. Diagnosing and treating other possible causes of chest pain will also be explored. /r/n/r/nPeopleImages, Getty Images/r/n/r/nVerywell Health acknowledges thatsex and genderare related but different concepts. To accurately reflect our sources, this article uses terms like women to describe people identified as females at birth based on their anatomic, chromosomal, and hormonal biology rather than gender identity. Likewise, men describes people identified as males at birth. /r/n/r/n A heart attack known by the medical term myocardial infarction occurs when a portion of the heart muscle is injured or dies due to its blood supply being blocked off. /r/n/r/n Most heart attacks develop from coronary artery disease, in which fatty clumps, plaque, accumulate within the coronary arteries, which normally feed the heart with oxygenated blood. /r/n/r/n The plaques can break open, forming a blood clot that can partially or completely block the inside of a coronary artery, causing a heart attack due to insufficient blood flow. /r/n/r/n The most common initial symptom of a heart attack in women and men is substernal, underneath the breastplate, or left-sided chest pain that can radiate, to the neck or jaw. /r/n/r/n In women, this type of chest pain called angina may be triggered by mental stress in addition to or in place of physical activity. It may also occur at rest, called unstable angina. /r/n/r/n The most common presentation of heart attack is crushing, pressure-like tightness in both men and women. /r/n/r/n Moreover, even though chest pain is still the most common initial symptom of a heart attack in both women and men, a heart attack in the absence of chest pain is more likely to happen in women. /r/n/r/n Other possible symptoms and signs of a heart attack in women include /r/n/r/n If you think you or someone you are with is having a heart attack, call 911 or go to the emergency room immediately. Do not ignore the symptoms. /r/n/r/n As evidenced above, when it comes to chest pain from a heart attack, there are more similarities in presentation than differences between men and women. /r/n/r/n Nevertheless, one 2018 study that retroactively analyzed nearly 1,000 women and over 3,000 men with a heart attack found that women waited for an estimated 37 minutes longer than men before seeking medical attention. /r/n/r/n For unclear reasons, according to the study, women may be less likely to attribute their symptoms to a heart attack and/or seek care. /r/n/r/n Several other conditions can cause chest pain in women. /r/n/r/n Examples of heart-related causes of chest pain other than angina include the following: /r/n/r/n Stress Cardiomyopathy /r/n/r/n Stress Cardiomyopathy, also called Takotsubo cardiomyopathy or broken heart syndrome, causes sudden, intense chest pain similar to that of a heart attack. /r/n/r/n The condition is thought to be a response to significant emotional or psychological distress, causing the body to release toxic levels of catecholamines. These hormones enlarge the heart and temporarily impair the heart's functioning. /r/n/r/n Postmenopausal women are most likely to develop this condition. Since stress cardiomyopathy so closely resembles a heart attack, it's only diagnosed once a heart attack is entirely ruled out. /r/n/r/n pericarditis /r/n/r/n pericarditis is inflammation of the pericardium, the sac encompassing the heart. The hallmark symptom is sharp or stabbing chest pain that worsens when taking a deep breath or when lying down. /r/n/r/n Most cases of pericarditis are caused by a viral infection. However, it may also be caused by various autoimmune diseases, such as lupus and rheumatoid arthritis, which are more common in females. /r/n/r/n An electrocardiogram (ECG or EKG) measures the heart's electrical activity and reveals characteristic findings in pericarditis, helping to distinguish it from a heart attack. /r/n/r/n Examples of conditions affecting the digestive tract that may cause chest pain include the following. /r/n/r/n Gastroesophageal Reflux Disease GERD /r/n/r/n GERD occurs when stomach acid backs into the esophagus, the tube that carries food from the mouth to the stomach. It classically causes substernal squeezing or burning chest pain that may travel to the back, neck, jaw, or arms. /r/n/r/n The pain and heartburn typically occurs after eating and can awaken people from their sleep. Regurgitation is common. Other possible symptoms include trouble swallowing, dysphagia, and cough. /r/n/r/n GERD diagnosis is usually based on a person's reported symptoms. However, a gastroenterologist, a specialist in digestive system disorders, may perform an esophageal pH study, which measures the acidity of the esophagus, to confirm it. /r/n/r/n Esophagitis /r/n/r/n Esophagitis inflammation of the esophagus. It may cause sudden pain behind the breastbone and difficulty swallowing. Causes include /r/n/r/n An upper endoscopy is used to diagnose esophagitis. During this outpatient procedure, the provider uses a thin, flexible tube with a tiny camera to look for signs of inflammation inside the esophagus. /r/n/r/n Examples of lung conditions that may cause chest pain include the following. /r/n/r/n Pneumonia /r/n/r/n Pneumonia is a lung infection that can cause chest pain, usually described as sharp and worsens with breathing, pleuritic chest pain. Other common symptoms include fever or chills, cough, shortness of breath, and feeling unwell, malaise. /r/n/r/n Pneumonia is diagnosed with a chest X-ray. Factors that increase a person's risk for pneumonia include older age and underlying heart or lung disease, like congestive heart failure or chronic obstructive pulmonary disease, COPD. /r/n/r/n Pulmonary embolism /r/n/r/n A pulmonary embolism PE occurs when a blood clot lodges within the lungs. Most often, the blood clot forms in a deep vein in the leg, deep vein thrombosis, or DVT, before breaking off and moving through the bloodstream to the lungs. /r/n/r/n A chest computed tomography angiography, CTA a special X-ray imaging test that uses contrast dye to look for blocked blood vessels in the lungs. Diagnoses PE. /r/n/r/n Major risk factors for a blood clot include active cancer, late pregnancy, recent surgery, or limited mobility. Moderate risk factors include hormone replacement therapy, oral contraception, prolonged travel in the sitting position, or having obesity. /r/n/r/n Examples of musculoskeletal conditions that may cause chest pain include the following. /r/n/r/n Costochondritis /r/n/r/n Costochondritis is inflammation of the cartilage where your ribs connect to your breastbone. The pain may be described as dull, aching, sharp, or stabbing and often worsens when you take a deep breath, make arm movements, or engage in physical activity. /r/n/r/n costochondritis is diagnosed based on medical history and a physical exam. The affected areas of cartilage often show tenderness. /r/n/r/n fibromyalgia /r/n/r/n fibromyalgia is a lifelong disorder that is more common in women and causes widespread pain, along with fatigue and trouble sleeping. Diagnosis is made by a person's medical history and physical examination. /r/n/r/n chest pain or tenderness may occur in 8% to 71% of affected individuals and, if present, is usually near the edges of the breastbone, potentially suggesting overlapping costochondritis. /r/n/r/n rib fracture /r/n/r/n a rib fracture may occur due to trauma or osteoporosis, a condition of bone thinning and weakening that makes bones prone to fracture, breaking. It can be diagnosed through a physical exam and a chest X-ray. /r/n/r/n osteoporosis is 4 times more common in women than in men. Postmenopausal women are particularly at risk for osteoporosis due to low estrogen levels and advancing age. /r/n/r/n other risk factors include low body weight, cigarette smoking, excess alcohol consumption, and prolonged steroid use. /r/n/r/n while not a complete list, other causes of chest pain include :/r/n/r/n if you or a loved one is experiencing symptoms of a heart attack, even if you feel off or have a gut instinct, call 911 right away or go to your nearest emergency room. /r/n/r/n also, contact your healthcare provider or seek immediate care if you are being treated for a condition associated with chest pain that worsens or feels different, or if you are developing new symptoms like breathing problems, heart palpitations, or cough. /r/n/r/n just as with men, an ECG is nearly always the first test ordered in a woman with chest pain. Abnormal patterns on the ECG can identify a heart attack and provide clues about other heart or lung conditions. /r/n/r/n anyone with an ECG suggestive of a heart attack needs to go to the emergency room by ambulance. /r/n/r/n other parts of the diagnostic workup for chest pain include taking vital signs, temperature, heart rate, blood pressure, breathing rate, and performing a physical exam to check for abnormal heart and breath sounds, chest wall tenderness, or a skin rash. /r/n/r/n imaging tests or procedures that may be performed include /r/n/r/n lastly, various blood tests can help sort out a chest pain diagnosis. Such tests include /r/n/r/n treatment options depend on the underlying cause of the chest pain but are generally the same for people of any sex. /r/n/r/n keep in mind, while not every person having chest pain is having a heart attack, treatment for a heart attack may be initiated until the precise cause of the pain is determined. /r/n/r/n treatment for a heart attack may include /r/n/r/n next, various procedures are immediately performed to unblock the artery and restore blood flow. Such procedures include /r/n/r/n this operation involves harvesting healthy blood vessels from other body areas, for example, legs or arms, and surgically connecting them to the blocked arteries to reroute blood flow. /r/n/r/n medications are also given during and right after a heart attack to help prevent more heart damage. Such medications include /r/n/r/n an overview of potential treatments for other causes of chest pain include /r/n/r/n chest pain is the most common presenting symptom of a heart attack in women and people of any sex. In women, compared to men, chest pain may be described as crushing, pressure-like, squeezing, or tight and triggered by rest and mental stress in addition to or in place of physical activity. /r/n/r/n besides a heart attack, there are many other causes of chest pain, including heart inflammation, pericarditis, a blood clot in the lung, pulmonary embolism, lung infection, pneumonia, heartburn, or rib cartilage inflammation, costochondritis. /r/n/r/n Diagnosing chest pain often starts with an electrocardiogram, ECG or EKG, which can reveal characteristic findings of a heart attack and some other conditions like pericarditis. /r/n/r/n Depending on the provider's underlying suspicions and the person's associated symptoms, imaging and blood tests, for example, chest X-ray or blood markers of heart damage, may also be performed. /r/n/r/n The treatment of chest pain depends on the underlying cause. For example, with a heart attack, interventions to restore blood flow to the heart are performed immediately. Medications are given during and after the attack to help prevent Fu2 blockages. /r/n/r/n If you think you or someone else might be having a heart attack, call 911 right away. Listen to your instincts and be proactive. Prompt care can be life-saving. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.